And so I think, trying to take that approach of, giving these little stickers, or we've even done candy just for like a little, good job. You've done great. What you're doing is important. It makes a difference. I think that can go a long way. So I agree, Jill. I think that the clipboard should probably stay in the office for some days.
Infection stops where information starts. Welcome to the Transmission Control podcast, where knowledge is your strongest defense. Broadcasting from the front lines of healthcare, we dive into the strategies, science, and stories shaping infection prevention today. Each episode, we connect you with experts on real-world insights to help you stop the spread of healthcare-associated infections, protect patients, and strengthen your practices as an infection prevention and public health expert. When the right information reaches the right people, lives are saved.
Hello and welcome to the Transmission Control Podcast. My name is Garrett Hollenbeek, Editor-in-Chief of Transmission Control. Today we're joined by Ericka Kalp to talk about how we can redefine a perfect accreditation survey by driving towards continuous improvement with those survey findings. We'll be right back after a brief word from our sponsors.
Brought to you from the studios of Healthcare HQ, let's get into it. This is Transmission Control.
Hello and welcome to the Transmission Control Podcast. My name is Garrett Hollenbeek, Editor-in-Chief of Transmission Control. And today we're joined with our host, Jill Holdsworth, and an exciting guest to talk about the perfect, quote-unquote, survey. Jill, how are you doing today?
I'm great. How are you doing, Garrett?
I'm good. And I know we just got back from HSPA last week, and it's always getting through the mountain of emails that piled up. And then I don't know if you experienced this, but after a conference like that, I come back with kind of just everything I want to change and implement, and then find that the real world intrudes on that. And then we have to go kind of step by step. I don't know if you have that experience after a conference.
Yeah, I mean, it's almost like the great letdown after a conference. You come back and you're motivated and excited, and then the real world hits you and you're going through your emails again and getting back into your everyday life, when at the conference, all you had to worry about was how you were going to change the world. And then you get back to the world and it's not ready for the kind of change that you felt at the conference. So it's like an emotional roller coaster, but I always encourage people to try and write down all those ideas, even on like the plane back if they can, because you don't want to lose that enthusiasm that you had when you were there. And it's easy to do once you get back and you get rolling in your real life again.
It really is. And that's part of what makes driving outcomes challenging. And the topic that we're bringing our guest on today, Ericka Kalp, is how to use survey results to drive positive change in your facility. So, Ericka, welcome to the podcast, and tell us a little bit about yourself.
Thank you for having me. My name is Ericka Kalp. I am the CEO of IPC Launch, which is a brand new company that I created just this year in 2025. And the goal of that company is to help others, such as healthcare industry workers, healthcare facilities, really try to launch their infection prevention and control protocols, initiatives, programs, and products. In addition to that, I serve as an associate clinical professor at Drexel University in Philadelphia, Pennsylvania. I've been in the infection prevention and control world for more than 20 years as an epidemiologist and an infection preventionist from acute care, long-term care, as well as public health settings.
Excellent. Well, welcome. And for those of you that follow and subscribe to the Transmission Control newsletter, Ericka wrote a phenomenal article on what it feels like to be a newbie in the IP space and when the kind of wings start falling off. And that's where we wanted to start this conversation. Is Ericka, have you ever been part of an accreditation survey that just went off the rails? Nothing went right. The staff overshared. The surveyor didn't know what they were doing. Have you ever had an experience like that?
I have. Most of the surveys that I've participated in have gone very well. However, there have been those occasional surveys where you're just thinking, like, what in the world did they just tell the surveyor, and why did they say that? So yeah, I have had an experience or two where things didn't go exactly as planned, as according to the script.
Ericka, when things don't go per the script, how would you say that you as the IP leader handles that? And not only you keep yourself calm, but how do you keep everybody else calm and help lead them through it?
So I really think that it all starts with your mindset going into the survey. Really, being prepared for the survey. Most surveys are unannounced. There are some that are announced. But in my experience, when things have kind of gone off the rails, stay calm and just try to assess the situation and do, damage control as best as possible. Maybe correct some mistakes that were made and information that was shared. Hopefully there was something that was not correct that was shared, and that they weren't just, saying they were blatantly doing something, wrong. The specific example that I'll share with you that kind of went off the rails during a survey was I was in a facility and there was a patient on contact precautions, and the staff were getting a little tired of getting gowned up, going in and taking care of the patient. And so instead of going in when the bell was ringing, they're just yelling from the hallway. And, of course, the patient has their curtain pulled. They can't see exactly what's even happening on the other side of the curtain. And that doesn't go over well for patients. And it certainly does not go over well when the surveyors are watching that kind of behavior. So that's one example that I had from my survey past.
I can imagine seeing that as an IP and kind of cringing. You're like, you know what you're supposed to do. This is not standard practice. And it really challenges like the perfect image of a survey that we have going into it. Because as you mentioned, we do all of this prep work. We have our golden hour checklist, and we generally want to go in and get no citations on the other side. That's kind of what's seen as victory for a survey. And in a meeting this week, and I probably could have phrased it a lot better when I said it, but I said about a certain site, they probably should fail their survey because they're not doing these things right. And whether that's wise for an IP to say, I don't know, it probably wasn't. But we want to challenge that notion that a perfect survey means a survey without citations.
And, I think sometimes we even think, I hope that this area does get cited on XYZ because they fight you on it every time. And so you feel like maybe I'll get more support on this if they just fail this one thing. And of course you don't want citations, but I think it's probably a little unrealistic to think that we're all going to have perfect surveys, because when you've got that, well, I don't know how many surveyors you guys have, but we have a lot of surveyors that come and they're there for the whole week. And if you've got that many people going around, they're going to find something.
First of all, I don't think there is a perfect survey. You may not get a citation, but it might be because they maybe overlooked something, or, they were just going easy on the facility. There's always room for improvement. Every person in the healthcare facility, there's room to improve. Always. I mean, small incremental changes usually stick better than, the reactionary changes that take place after you get the citation. But, I think that, Joe and to your point, I've been in the same spot where you kind of wish, like, yeah, I hope the OR, I hope that one of the other facility or one of the other areas in the hospital, they do get a citation because they deserve it. They've been not, cooperating with,
they deserve it.
I mean, that kind of.
I love that.
But I mean, I think we've all felt that, like, you feel like a broken record going around and around, telling them what they already know, and they're just obstinate. In some cases, they're not obstinate, and they're just not thinking. I mean, they are busy staff. They've got patients to take care of. And, they see the infection preventionist coming and they're like, oh, great, here comes, the pain down the hall. So, but I totally get it. But, if you look at it again, back to the mindset of, there's definitely room to improve. We're all there for the same reason. We want patients to come to the facility. We want them to be treated with the best evidence-based care. We don't want them to get infections while they're, within our settings. And so it takes a group effort to ensure that takes place.
It really does. And I think that's an important thing that you emphasize, that sometimes we do things as a reaction to a survey or a particular finding, and then we go out of character and we start building in crazy processes and a double check on things that maybe don't need a double check. And is there a way that we can shift that mindset from we're doing it because we're in our survey window to we're doing it as part of continuous improvement?
Yeah, so that is tough. What I would suggest and what I've helped other facilities do is, make it part of the culture. It is going to be tough. There's different stages of adoption of different interventions. And so some people are ready to jump on and join, the new processes, and others are just going to dig their heels in and not want to do that. And so the balance is, trying to get everybody to move in the same direction at the same time and, really focus on the goal. The reactionary, actions that people do, because they get a citation, oftentimes it causes confusion among staff. It causes sometimes distrust among staff. And, it makes people have more anxiety when there's more surveys that are coming down the road. But, if you turn it into like, this is the way we're going to do business, this is the way that is expected, not just on policy, in the policy or on paper, but this is how we're going to operationalize our day-to-day work. And it becomes the expectation. I think people can relax a little more when it is time for surveys to take place, and they feel more confident in speaking with the surveyor if they truly understand what they're doing and the reason why they're doing it for patient safety.
Yeah, that's a hugely important point, because sometimes we treat Joint Commission standards as independent of patient safety, when really there should be alignment between, yes, it is a Joint Commission standard and we are complying with that, but we're complying with it because it's a patient safety concern.
Yes, exactly.
Yeah, I think that a lot of times our team members don't connect the why, and they just find this whole process very annoying. I find myself still talking about the things we got cited for a year ago, and I think it's people want to forget about it. They want to say, we got through the survey and we turned in our action plans, and let's move on for 3 years. But this is continuous, and so it is hard to connect the dots sometimes to these standards are in place for a reason, not just to annoy you, but to keep people safe. There's a reason why they chose these standards.
Right. One thing that I've found to be helpful, because not everyone does understand it. I mean, you can hold all of these lunch and learns and things like that. But, again, that only goes so far. But what I've really tried to do in the past is find like a champion on the unit or in the department, and, maybe have them identify another person in the front line, who might be a frontline worker, and say, okay, let's talk about this. Let's see what you suggest as a solution, because sometimes whenever we come in with our clipboards and your checklists and all of that, it's very off-putting and they don't want to hear it, But I believe that, if they are part of the solution, I always say for every complaint, you should have 2 potential solutions that come along with it. So, what would they suggest to fix the problem? I mean, people who are working in healthcare, they're in healthcare primarily because they want to help people. And so, I think their heart is good for it. And, they want to do it. They just, to your point, Jill, they don't understand why they have to do X, Y, and Z. And so by trying to get them to understand the why and actually be part of the solution, I think you get so much more buy-in from the staff.
Yeah. I like that. I'm glad you brought up the clipboard, because that concept has come up a couple times this season already. And Jill, we need to start putting little games in here to say, how many times does the word clipboard come up?
In the whole season.
Yeah, in the whole season. That'd be fun. But Jill is an advocate of, kind of there are times to not bring the clipboard in and use it as team building. and I myself am a clipboard warrior. Like it's with me. So I think the approaches can be different, but there is a loss. And I've even seen this in my own practice where when you come up with a clipboard and you say, I'm reading off this prescriptive way of doing things, as opposed to the approach that you highlighted where you say, well, Bob or Becky, you do this work every day. Where can it be improved to comply with the standard?
Yeah, I totally agree with that. What I've found is that positive reinforcement, you get a lot more buy-in when you're positively reinforcing people. So I remember a couple of years ago, we were doing hand hygiene audits. And of course, they see you come in, but I didn't have a clipboard. I just had stickers. And so I would just hand out stickers for every time I saw that, somebody was practicing good hand hygiene. And so I got to the point where I ran out of stickers, and then staff were upset that they didn't get a sticker. So, the thing is, it's, we all like to be rewarded for something, for doing something well. We like to be noticed, and just seen. And so I think, trying to take that approach of, giving these little stickers, or we've even done candy just for like a little, good job. You've done great. What you're doing is important. It makes a difference. I think that can go a long way. So I agree, Joe. I think that the clipboard should probably stay in the office for some days.
I don't like having that stereotypical look when I walk onto the units, like I'm here to audit. So sometimes I'll have my audit printed out, but I fold it up and like put it in my back pocket or something so I can take it out and write a note or something. Or you have the little tiny notebooks that you can put in your pocket. But I hate to have that stereotype of, oh, she's here just to audit or to look at us. I want people to think I'm just there to, hang out, say hi.
Yes.
That aesthetic is just, it's so ingrained, that clipboard, audit approach. And I think that's ingrained in a lot of ways because we do some check boxing where we say, yes, I did my hand hygiene to that point, but did you do it correctly? Did you let the alcohol-based hand sanitizer dry, or did you wipe your hands off as soon as, you got it around? And it begs a question that once we receive our audit results, once we have a citation, how do we respond to that?
So if there is a citation, like I mentioned before, some staff, some managers, some leadership, they can get pretty upset. But, again, I keep going back to this. It's the mindset of it. You need to really encourage the growth mindset of, we're going to learn from this. A specific example that I found to be helpful when we had a survey years back, we found that, as the surveyor was talking to the staff, they were upset about the way that the linen was handled, and that when they would get clean linen out, isolation gowns, they would find like balled up gloves actually mixed up in the gowns. Yeah. And so that kind of thing, we didn't even know about that. Like they hadn't shared that with us, but yet they shared it with the surveyor. So that brought to the attention of everybody, which at first you look at it and you're like, oh my gosh, why didn't you tell us before? But also there's some benefits to when you do get a citation, because then all eyes are on the problem, right? Like, whenever there's a citation given, most of the time they're not just making something up like willy-nilly. There's a reason why they're doing it. You can go back to the evidence. These surveys are very much open book. Like, what they're going to look for the most part. I mean, it's not a secret. You can go online and do research from CMS surveys, TJC surveys, Department of Health surveys. It's not a secret. And so, being prepared is definitely the best policy. However, citations will likely arise, and it's how you respond to those and how you engage the staff, how you try to engage your leadership. It's really helpful. You might have leadership who's, really kind of down to earth, and they're like, okay, let's take a look at this. Or you might have somebody like, everybody's fired, it just really depends on the culture of the facility. But, taking things step at a time is really the best approach. Again, implementing standardized processes and auditing that without a check or without your clipboard, but really, in all seriousness, using the staff to get to the solution of the problem. If there were, back to the isolation gowns, there were, why are their gloves balled up in the isolation gowns? Well, The answer is that there wasn't a garbage can nearby, so they just left the glove in the isolation gown. So by just offering a trash can right there, then we could solve that problem. So it just takes a little bit of digging to find the whys, like why is this happening, and let's work together to try to find a resolution for it.
And sometimes that can be tricky. I've seen, in surveys of the past, sometimes infection control isn't always the person that needs to lead the action plan or lead the initiative afterwards, but it seems like everything gets cited under us because that IC chapter is so big and it just keeps getting bigger. So what would your advice be to the IPs of how do I make sure that I'm involved, especially if you're not asked to be involved? That these things got cited. It's kind of your charge, but you're not in charge.
Right. So one thing that I suggest is to really be involved with your environment of care rounds and the people who are on those rounds. At least in my experience, the people who are on the rounds for environment of care, it's a multidisciplinary team. It may include environmental services. It may include a representation from nursing. It could be sterile processing, the OR, the emergency department, employee health. So chances are that whenever you develop a relationship with the people who are part of this multidisciplinary rounding group, you have that opportunity to build you build that relationship first. And then when the problems come, then you have something to work from. It's not just like, hi, my name is Ericka and I've never met you before, but you have a problem in your department, versus, we've been working on this together. We've been surveying these departments together for the last 3 years, and we know where the problem spots are. So I think that's what I would recommend is just try to get engaged multidisciplinary on those rounds ahead of the surveys.
Yeah, I think that drives to the continuous mindset culture in a facility. Because if I check the same 10 things on every environment of care round, then those are the things that get improved, and then everything else falls by the wayside. So is it helpful to have, environment of care round, list of items that you check every time, or should it change from round to round?
Well, I think having a list is a good start, especially if you're training somebody new. I think that's a good way to just show them, this is the type of things that we look for. But I really encourage people to kind of go off the script and just look around. I mean, you may not have, looking at the ceiling tiles on your list, but you should be looking for that because the surveyors are going to look for that. I would look at, in the published literature, what's likely to be cited? What are they looking for most recently? Or what type of outbreak is there going on right now that, if they come in, they want to see how well you would respond should you have a patient present in your emergency department. And they may do a tracer, based on that. So I think it's really important to kind of stay one step ahead with the survey.
I would agree with that. And they do a great job of putting out bulletins periodically of, this is our position on this. This is a frequently asked question. They have the FAQs on the Joint Commission website that are a really helpful guide for what to keep an eye out for. Now, shifting gears a little bit to, we have the citation, we get it improved, we do our action plan. How does that action plan inform the IPC plan for the year?
So the IP plan should be looked at least annually. There are many reasons why you may want to look at your IP plan more frequently. Most of the facilities I have been in, they have an infection control committee that meets on a monthly basis. And it's not a bad idea to have that as a standing agenda item. And the reason for that is, there are different variables that change. So your IP plan is going to be based, or your risk assessment is going to be based on what's happening both internal to the hospital as well as what's happening external. So as I mentioned about different outbreaks in different regions, they may be currently you might need to have a higher threshold of surveillance for measles or something else. But, whenever you're coming together and meeting with your infection prevention and control committee that has the ID docs on it, hopefully it has your laboratory personnel on it, that is the best place to kind of have that dialogue where you might need to modify going forward based on external factors.
I'm glad that you said the risk assessment too, because a lot of people dropped their IP plans once the requirements changed. Because, let's face it, a lot of people were just using it as a document just to have words down because it was a requirement. But the risk assessment can be a living document that can be updated and changed, and that you would put, whatever risks that you saw. And certainly a survey, or even a state survey, OSHA survey, those types of things can weigh in on your risk assessment too. So I think that's a great point.
Mm-hmm. And it's current because we've had issues with measles. I don't know how many IPs had measles on their annual IP plans, but it's something we need to potentially, depending on your community and what's going on locally, to be prepared for that and have an action plan in place that identifies that risk. When you are working with your infection control committee, and I like that you have your ID docs on there in your laboratory, because as Jill said, IP affects everything. But sometimes we don't give the right voice or the right kind of table to express those concerns. How have you seen it done well with an IPC committee?
In terms of who's involved, who's on the committee.
Yeah.
So in my experience, both working as an infection prevention and control director and also going into facilities as a consultant, what I've found that the best mix of the infection prevention and control committee members is a mix of, the people who are doing your environment of care rounding. So that would be your EVS staff, plan operations, because we know that any life safety issues, any ventilation issues, that's really important that you have that person at the table to weigh in. Also, to have physicians there. We had our chief medical officer on our committee. So that way if we had issues with the medical staff, we could say, hey, this is something that we're struggling with. And then that was our conduit to the medical staff. By having the laboratory on and pharmacy, that's super important. With antimicrobial stewardship, keeping a pulse on what's happening with the resistant organisms within the hospital, as well as what's happening in the community. So what are our outpatient labs looking like as far as what type of resistant patterns are we seeing in the community? Because that ultimately will impact eventually the hospital setting. We even had a community member as part of our committee where, they would come in and they would just give any concerns that they had, or they were very involved with the patient and family service committee, the committee that we had for that as well. So, it takes a group of people with different backgrounds. You get different perspectives. That doesn't always make it easier because of, different people, but it gives you a more comprehensive and holistic look at your infection prevention and control program, as well as what's happening in the community around you.
Yeah, that's I like how you broke that setup down, because that's a challenge for any, last season we talked about new IPs and that orientation journey. And that can be one of the big challenges, is setting up your IP committee in a way that's going to drive continuous improvement. For IPs that are listening to this episode, what are some go and do's that they can tackle this week related to continuous improvement, preparing for survey, and really building out their IP team in a way that drives patient safety?
Well, the first thing that I would suggest is, if you don't have a risk assessment, an infection prevention and control risk assessment, to get that. If you need help, you can contact me, or any infection preventionist would be willing and able to help you with that. So that's really important. You need to know the status of what's going on in your facility. In order to prepare effectively, you need to know the status of what's happening. I would also encourage, reach out to your quality and risk team. Most acute care facilities have the staff. I was just reading the other day that most hospitals have between 20 and 50 people that are engaged in preparing for a survey. So you have a lot of people, depending on that might not be for a rural hospital, but there are a lot of people that are hired on staff in these healthcare systems. That's their specialty. Their specialty is risk. Their specialty is quality. They know the regulations and the standards inside out and backwards. And so use the people that you have there. And if you struggle to really find that person, if you belong to your local APIC chapter, that's a great resource for a lot of people to get some information. Also, the APIC, they have some listservs that you can enter in some questions online and get some responses rather quickly. So I've found in this field that most people are very willing to help and share. You just have to be brave enough to ask for help.
Yep. That's an excellent takeaway, and one that I think we can apply to all areas of our IP program, not just survey readiness. When we look and we round with quality or we round with accreditation, they're looking at things through a different lens. And I think it's helpful for IPs to kind of, to your point, take maybe a step back or a step to the side to say, all right, we're going to attend accreditation rounds today or at this facility and watch their process and see where can we derive best practices. Well, Eric, I want to thank you for the insights that you've shared today and for your experience and work in IP and public health. And where can folks get in touch with you to learn more about survey readiness and having a great IP program?
Well, you are welcome to contact me at my website, which is www.ipclaunch.com. You can fill out a form. I'd be happy to talk with you about any questions that you might have.
Well, thanks so much for a great podcast episode. And for those of you listening, stay tuned for the rest of the season where we talk about redefining what a perfect survey means to infection prevention. Ericka and Jill, thank you very much.
All right. That was a great episode with Ericka Kalp. And I have to say, I just love her positive energy. I don't know about you, Garrett, but I feel like if I had an IP like her in my facility who was coming around and saying, it's okay, we failed Joint Commission and we just have to do all these action plans. I don't know. I think it would be okay because the way that she seems to take her approach, it's a collaborative approach. It's all about teamwork and working together. And I just really like that. I really liked her energy and her approach to surveys in general, and especially the post-survey fields.
Yep. I agree with that. And it takes a different approach when you go into it with, hey, we can manage this. And I like the call out that she had about asking frontline staff, how would you approach this issue to get to compliance? It's a kind of a grassroots approach that I think builds in really that redefinition of what a perfect survey is. A perfect survey should have frontline collaboration. And if you listen to the episode and you don't have a community member on your IP committee, or if you do, I would love to hear what that looks like for you and for your team. So let us know. Reach out to Jill and I, and we'd love to hear that because I've never heard of having a community member
I love that.
on your IP committee. So it's all about changing the way we do things and drive continuous improvement so that infection stops where information starts.
Thanks for tuning in to the Transmission Control Podcast, where infection stops because information starts. If you enjoyed this episode, let us know. Connect with us on LinkedIn, Facebook, or wherever you get your podcasts. Don't forget to leave a 5-star rating and share this episode with your team. Until next time, stay informed, stay vigilant, and keep transmission under control.